Dr. Berg has done an excellent job educating people about insulin resistance, and his videos have helped millions.
But he missed the 7 critical signs of insulin resistance that will shock you.
I'm Dr. John, and today I'm revealing the blood work markers and clinical signs that most doctors, Perry's, even Dr. Berg, don't talk about.
These markers can detect insulin resistance years before you develop diabetes. Let's get started with sign number 1. Sign number 1 is elevated uric acid levels. Most people think uric acid only causes gout, but that's not the whole story. High uric acid blocks an enzyme crucial for insulin sensitivity, creating a vicious cycle that worsens your metabolic health. Check your uric acid on your next blood test. If it's above 6, you need to talk to your doctor about insulin resistance. Sign number 2 is low SHBG, sex hormone binding globulin. This is one of the earliest markers of insulin resistance. Studies in Diabetes Care Journal showed that low SHBG predicts type 2 diabetes development years in advance. For women, SHBG below 30 is concerning. For men, below 20 suggests insulin resistance. Sign number 3 is elevated ferritin cadmium, and I'm not talking about iron overload disease. This is different. High insulin levels increase iron storage in your liver, and this iron accumulation interferes with insulin signaling. Research in the Journal of Clinical Investigation found that excess iron in tissues worsens insulin resistance through oxidative stress. Ferritin above 200 in women or 300 in men can indicate metabolic dysfunction, even when your actual iron levels are normal. Sign number 4 is small, dense LDL particles. Your standard cholesterol test doesn't measure this CAF, and that's a problem. Insulin resistance shifts your LDL from large, fluffy particles to small, dense ones, which actually causes heart disease. Research in Circulation Journal proved that small, dense LDL easily penetrates artery walls and triggers dangerous inflammation. Request an NMR lipoprofile or cardio IQ test. Look for LDL particle number above 1,000 or pattern B dominance. Sign number 5 is elevated GGT, gamma-glutamyl transferase. This liver enzyme is hidden in plain sight on your labs. Doctors focus on AST and ALT, but research shows GGT is a better predictor of diabetes development. GGT reflects oxidative stress from insulin resistance. It rises earlier than other liver enzymes, giving you an early warning. GGT above 30 can indicate early metabolic dysfunction. Optimal is below 25 for men and below 18 for women. Sign number 6 is your triglyceride to HDL ratio. This is called the poor man's insulin resistance test. Below 2 is optimal. Between 2 and 3 is concerning. Above 3 is a strong indicator of insulin resistance. A circulation study showed this ratio predicts heart attack risk better than LDL cholesterol. Its accuracy rate is 65%. The final sign is elevated hs-CRP, high sensitivity C-reactive protein. This measures metabolic inflammation. Insulin resistance is fundamentally an inflammatory condition. Your fat cells release inflammatory molecules that worsen insulin resistance. Research in JAMA found that elevated hs-CRP predicts type 2 diabetes development before blood sugar becomes abnormal. Optimal is below 1.0 milligrams per liter. Above 3 indicates high metabolic risk and chronic inflammation. Research in JAMA found that elevated hs-CRP predicts type 2 diabetes development before blood sugar becomes abnormal. Optimal is below 1.0 milligrams per liter. Above 3 indicates high metabolic risk and chronic inflammation. Optimal is below 1.0 milligrams per liter. Above 3 indicates high metabolic risk and chronic inflammation. Let me quickly recap these 7 hidden signs that Dr. Berg and most doctors don't emphasize. Number 1, elevated uric acid. Number 2, low SHBG. Number 3, elevated ferritin. Number 4, small dense LDL particles. Number 5, elevated GGT. Number 6, high triglyceride to HDL ratio. Number 7, elevated hs-CRP. Don't wait for your fasting glucose to be abnormal. These markers detect insulin resistance years earlier. You can reverse insulin resistance if you catch it early. Early detection means easier reversal. Dr. Berg does amazing work educating millions. These are just additional puzzle pieces for complete metabolic health.
If this was helpful, subscribe for more evidence-based health information.
Thanks for watching, and I'll see you in the next video where we discuss how to reverse these markers naturally.